Hey, my name is Jason. I'm a registered polysomnographic sleep technologist or a registered sleep tech, and I want to do a quick overview of how CPAP works. So CPAP, a lot of people think that it gives them oxygen. CPAP doesn't give you any more oxygen than what's already in the room air. What CPAP does is it treats your upper airway kind of like a car tire. You know how all the air in a car tire holds up the weight of the car? That's similar to the effect of how CPAP works on your upper airway to keep it open and keep you breathing through the night. So I'm going to give you a little demonstration. It's a little corny. What this is, it's mainly just for the obstructive events. So you have obstructive sleep apnea, obstructive hypopneas, and then RERAs, which is respiratory effort related arousals. Similar to a hypopnea. I'll kind of show you those. But as of right now, all right, this is what we're working with. So this bag, I'm going to go ahead and turn it on. All right, so this bag right here is going to be our breathing person. I have it kind of rigged to try to breathe a little bit. It's kind of fluttering a little too much, but I have a little hole right here so that there's a leak. Right now the leak is showing 10. We're gonna pretend like even though CPAP is on them right now, actually CPAP is not on them. So this person's up, but you can see how this is like their upper airway. So this is gonna be like the throat area. And so obstructive apnea occurs, or hypopneas. Any obstruction occurs when maybe you have a larger tongue than normal and it slides back while you're sleeping into your airway. Maybe your uvula is too large. Maybe your soft palate sags in your upper airway. You know, any number of reasons, but it's some obstruction that's causing you to not be able to breathe. So right now, this is how they should be, and walking around, and if they were to lay down, that's what you want their upper airway to look like, nice and open and big. So this guy's at the sleep lab. By the way, these bowls are just to keep things framed nicely. All right, so this person's at the sleep lab, and they're awake right now, and now they're gonna go to sleep. And of course, we have a baseball bat, and it is, oh boy, that's not good. This guy's not sleeping well. So you can see that it's absolutely completely collapsed, right? The weight of that bat, they're suffocating. Every now and then they're getting a gasp in, so it's like fall asleep and then they can breathe again. So with this apnea, what that looks like for a sleep tech during the night is you'll have your breathing waveforms, and they'll be breathing, and then it's just a flat line, and they'll resume breathing. Meanwhile, their chest and abdominal belts that we put on people, they're always trying to draw a breath. They're just not able to because of the obstruction. So they're sleeping, then the old bat or the obstruction gets in the way and chokes them off, and then you go and draw a breath over here. So that's kind of what we're looking at there. So in the lab, we say, oh boy, and then we go ahead and we find a CPAP mask. We put it on them. We say, there, little buddy, you're gonna be okay. And now I'm gonna go ahead and I'm gonna increase the pressure. So right now, you know, they had nothing on them, so now we're gonna go ahead and put CPAP on them. Whoa. And so I just increased that by 2 centimeters of water pressure. And you can already see that it's not quite collapsing all the way. It's close, it is every now and then. So what that turns into is kind of like hypopneas and apneas. So you'll see the apneas, but you'll also see hypopneas where it's big breathing and then it gets shallow and then big. And then these are the belts. And so some air is getting through, then every now and then no air is getting through. So that's after we increase the pressure. So that's keeping the airway open more. So what happens if we increase the pressure even more? This is exactly what techs do in the lab. We're gonna increase it another, we'll see, maybe there's one more. And now another centimeter of water pressure. So these are more like hypopneas. So we're definitely seeing these. So now we're just gonna go ahead and we're just gonna blast him. We're gonna take care of this guy. Okay, so this is pretty similar to what we were seeing before when this guy had no bat on his face. Oops, we still have CPAP on him. So this is similar to what we were seeing before. So even though we have the leak right here, the guy's breathing. What we're now seeing is, and this is again what we're seeing on the screen when we're having people sleep. This is their breathing. We're seeing them breathe normally. Then their belts, they're trying to breathe, and the air is actually getting through. So right now, I mean, maybe there is a little tiny collapse, and that might be RIRA. And again, check out those definitions on my website if you're not sure. But now we have this pretty cranked up and the airway is open. Now if this were a real person and you got them up too high, they might start having central apneas or something. But just for the purposes of this demonstration, we have CPAP on, we have the obstruction of maybe they have a huge uvula or their large tongue is falling back, and the pressure of the CPAP is totally pushing that out of the way. So what happens if in the morning the night technician were to turn off the CPAP while the patient were sleeping, and this would be them going back to normal. Boom, and it collapses again without CPAP pressure. And then you can see that with CPAP turned on again, it's going to hold that open. So hopefully that demonstration wasn't too bad. You can kind of see that adding pressure is going to increase the amount of weight that can be moved by CPAP. So you increase the CPAP pressure, that gives it more energy to move more mass. So that would be moving the tongue out of the way, moving the uvula out of the way, or just helping create an opening in the upper airway for air to pass. That's the gist of it as far as obstructive apneas, obstructive hypopneas, and RIRAs are concerned. It gets a little different when you start dealing with central apneas and whatnot. I can't think of an experiment to work with that. Anyway, hopefully this answers your questions of how CPAP works. If you have any comments or questions, you can visit my website. It's freecpapadvice.com, or you could visit my forum, which is freecpapadvice.com/forum. Join the website, and it's free. You can help other people out. You can get advice, give advice, blah, blah, blah. Anyway, I hope you enjoyed it. Again, my name's Jason, and thanks. Have a great day.